Hey there, everybody, and welcome to this sort of impromptu, if you will, discussion about starting a mental health practice with seniors. I know there are a fair number of people who actually really do like working in person, and there is a huge market for working in person with seniors. I can't remember what the number is off the top of my head, but it's tens of thousands of people cross that divide, if you will, of qualifying for Medicare, becoming considered elderly, if you will, every single day. So we have a huge growing population, and a lot of older adults, in my experience, still have a big stigma surrounding seeking mental health care. So in this discussion today, however long it lasts, I wanted to share some of the experiences I've had creating a private practice with seniors, some of the things I can share with you, and some of the ways that I have found most effectively engage seniors, especially if you're working in ALFs, for example. So, hello, wonderful. I'm glad to see you. Hello to Tanya and Joe. Good to see you as well. So, one of the things that a lot of people don't realize is that counselors, LPCs, LMFTs, and LCSWs can now bill Medicare as of 2024, January, can now bill Medicare for providing psychotherapy services to seniors. Currently, the average reimbursement rate, it's not wonderful, but it's not horrible. It's right around $95 for an hour session. Now, with seniors, sometimes you need to do shorter sessions, and you can do a 30-minute session. And basically, two 30-minute sessions, you get paid about the same, little tiny bit more, but about the same as you do for one hour session. So if you've got an older adult that just doesn't have the energy to do an hour session, which a lot of them don't, that's fine. That's fine. Let's do a 30-minute session. You can do groups. Now, Medicaid's reimbursement for group is quite honestly pitiful. It is, I think it's $24. I don't even bill it anymore. You can only have like up to 10 people in group, and it's $24 flat rate. If you do a 45-minute group or a 2-hour group, it doesn't matter. You only get $24 per person, or right about that. And the rates will differ based upon your MAC, your Medicare administrative contractor. If you want to bill Medicare, now this is one of the things that we were never trained in. It's a lot like getting credentialed to and paneled to provide services to people on Blue Cross or Blue Shield or one of those others. The first thing you've got to do is go to the Medicare website, the CMS website, and apply to become a Medicare contractor. This process for the average person, from the time you complete the application, which doesn't take terribly long, to the time you get approved, can be 4 to 6 months. So you want to give yourself some lead time if you want to start doing this. Don't think it's going to happen in 2 weeks. You get approved as a Medicare contractor, and you will get a letter from your Medicare, your MAC, your Medicare administrative contractor, that says, hey, you're approved. This is they call it a PTAN, PTAN. And I don't remember what it stands for. It's like provider transaction something number. But your PTAN is what identifies you in the Medicare system. Yes, you still need your NPI like you need for everything else. Okay, once you get your PTAN, you're like, woohoo, I can bill Medicare. Sorta. You can bill Medicare Part B with a PTAN. If somebody has a Medicare Advantage plan, then you're going to have to get paneled by each Medicare Advantage plan in your area. And that's where it starts to get a little bit cumbersome. Again, it's not hard. It's just a little bit time consuming. Best suggestion I have for you is, in my experience working here in Tennessee, when we've gone into the assisted living facilities, generally they're about 60% of the people are on Medicare Part B. So straight up, you just need your PTAN, woohoo! And then the other 40% have Medicare Advantage. But a lot of times it's clustered. So the majority of them will have Medicare Advantage through, around here, Cigna is a big one, and Humana is another big one. So you want to look and get the most bang for your buck, so to speak. If you're only going to get paneled by a few Medicare Advantage companies, figure out which ones are most popular in your area. So get your PTAN through Medicare. You go to the CMS website, and you go to Medicare, and it says for providers, and you walk yourself through the process. It's pretty self-explanatory. Then you wait, and you wait, and you wait. Once you get your PTAN, great. Now, one of the things I guess I should have said before that, if you haven't done it already, and you probably have if you're already taking insurance, you need to make sure that you have a CAQH profile. Now, most insurance, commercial insurance requires that, so I don't even usually talk about it because guess what? You've already got that done, which is wonderful. But once you get your PTAN, you need to update your CAQH because there's actually a special spot in there for your PTAN as well as your Medicaid number if you decide to get that. There are some people who are older adults who are what we call dual eligible. They are on Medicare and they are low income, so they qualify for Medicaid. The benefit is that Medicare pays 80% and the individual has a 20% copay unless they have Medicaid. And if they have Medicaid, then Medicaid picks up the other 20%, so you don't have to bill the patient at all. So that works for your dual eligible people. Now, again, it's very different when you go to Medicare Advantage plans, and those operate a whole lot more like traditional commercial insurance. There are some hoops to jump through with getting credentialed and paneled and all that, but once you've done it, then you're golden. You don't need to have fancy schmancy stuff in order to bill. If you're billing through somewhere like Therapy Notes that already assists you with billing and already has a clearinghouse, then it's easy peasy. If you're still trying to bill on old paper forms, it's going to be a little bit harder. Where can you find these older adults? Oh, they're everywhere. Older adults are in assisted living facilities. Now, I love going to assisted living facilities because it's kind of like going to a residential treatment center and doing rounds. I go in, I know that I'm going to see these 6 residents that day. We call them residents, not patients. I'm going to see those 6 residents that day. And, I go in, bada bing. I don't have to worry about them if they can get to the appointment, if they're going to remember the appointment. Sometimes they forget, but a lot of times, even if they've forgotten, they're still on the premises. So you can still do the session. So that works out really, really well. A lot of older adults, if you can get buy-in to your services, they love having you come by. A lot of older adults are lonely because they're not going to work and interacting with people anymore, whether they're aging in place, which means living at home, or they are in an ALF. A lot of them struggle with loneliness. And you're like, well, in an ALF, they're surrounded by tons and tons of people. Well, maybe. ALFs are not as crowded as one might think. But a lot of people in the ALFs stay in their rooms. And not to diss the ALFs, but a lot of it comes down to, in many facilities, comes down to cost. If there are activities going on all day long, then there is more to manage. They need more caregivers to be there to help transport people around who are not independently mobile. There is more issues come up. So a lot of the ALFs really prefer to allow residents to, quote, do their own thing between breakfast and dinner. And, they come out for meals, but there isn't a lot of other programming that usually happens on a daily basis. Some ALFs have volunteers come in and they do periodic groups. One of the ALFs I work at has bingo every single day at 2:00. So there are a few things that may happen, but largely what I've heard from the executive directors, the EDs, is we just can't afford to have that many caregivers coming here, and so we can facilitate lots and lots of programming, which again is where we come in. You can't treat and bill Medicare for loneliness, but a lot of older adults that are in ALFs may be struggling with adjustment issues. If they're an older adult that's aging in place, but maybe they have had to move in with a caregiver, move in with their child or something, again, that may be an adjustment issue. So adjustment disorder may qualify, or they may qualify for adjustment disorder. Depression, very common in older adults, and anxiety. Anxiety is huge in a lot of older adults. Now, dementia, even if the older adult has it, traditional psychotherapy is not going to treat dementia. It's going to help them accept their dementia diagnosis. It's going to help them be more compliant with their dementia treatment plan, because there's a lot we can do to slow the progress. But we're not, as therapists, we're not going to go in and specifically treat dementia. So I've never tried to bill that as a primary reason for me seeing them. What I'm seeing them for is adjustment, depression, anxiety. Okay, so another little interesting thing is you can bill family therapy with or without the patient present to Medicare. They two different codes, and you can look in your CPT codes and find which ones they are, or you can just ask ChatGPT and it'll tell you. Family therapy with the patient present is designed to help the family members support the older adult. This is most appropriate when you're working with somebody who's aging in place and their family are their caregivers. So you're trying to help the family help the older adult. Family therapy without the patient present would again focus not on the caregivers or the family person's need, but how the family person's what the family person can do to help the older adult. So it may be, I'm going to talk to Sally about strategies she can use to help manage her mother's sundowning. And how you write it up is important, because when Medicare looks at it, they're going to say, how does this relate to the identified patient, the person who has Medicare? How does this relate to their treatment? And if it's just helping Sally deal with her grief over her mom's dementia, that ain't going to cut it. But you can bill Sally's insurance. So a lot of times you'll find that caregivers or family members are struggling with acceptance of whatever's going on with their aging relative, and they're experiencing grief or anger, or they have unresolved trauma issues or something. They got stuff. And if you also accept private insurance or private pay, you can bill private insurance for treating the family member if they want treatment from you, or they can get treatment somewhere else. That's up to them. But if they're open to it. That is perfectly legal and ethical. Hello, Boo. So those are the big things. Now, as far as engagement is concerned, most older adults, at least right now, most older adults and older dogs, yes, don't want to hear or don't want to attend groups that are overtly mental health oriented. They are very unlikely to go to a group or agree to treatment for depression or anxiety. But they are willing to address somatic symptoms like restlessness, pain. Those are two of the big ones. Difficulty sleeping. That's another good one. But ultimately, what we're going to be helping people accomplish in these groups are learning stress management skills. Most older adults have sympathetic dominance, which means their stress response system is way stronger than their relaxation system. And that contributes to systemic inflammation, brain fog, sleep problems, all kinds of things. So a lot of the holistic interventions we would use for depression, we're going to use for chronic pain management. And you can tie, if the person has anxiety, irritability, you can tie their chronic pain into that diagnosis so you can justify that group. Medicare is very specific about what needs to be in the assessment. About what needs to be in the assessment as well as the treatment plan. The treatment plan has to be signed by the patient. Not a big deal, but it has to be signed by the patient or Medicare will claw back any reimbursement that was made to you for services provided. So those are a few little caveats that you want to be aware of when working with and the same is true for Medicaid. Let's see. Do medical, hospital, and send text messages with click here to pay a bill, no more bills in the mail? Seems fishy to me. I would be very suspect of that. I have always, my chief technology officer, who's also my husband and a computer forensic investigator, has always told me, if you don't know what it is and it says click here, don't click on it because it very likely is a phishing scam. And I've been getting, on average, 5, 6 phishing emails every couple of days. And I don't get a lot of phishing emails on my text, but I have gotten a few. So it is becoming more prominent. Anything that says click here and to pay, that's always very, very sus. I would call the hospital. If it says it's supposed to be from St. John's Hospital, I would call the St. John's Hospital billing department and say, is this your practice? Did you send this to me? Most likely they're going to say no, because my guess is it's even a violation of HIPAA unless you signed a waiver. Well, I'm glad you're out walking the shepherd, Crystal. That's wonderful. Well, I'm glad your therapist thinks that there are resources on the channel that are helpful for you, Tatiana. We do have a live Q&A every Monday in which I take questions from y'all on pretty much anything mental health related. Well, if you had a hospital stay recently, that's fine. It doesn't mean that hospital is sending you a text message for you to pay your bill. It could be that somebody is spoofing their email address or their phone number and trying to collect your payment data. So again, I would call the hospital and their billing department directly and ask them how your bill will arrive. I think most hospitals still send you a paper bill. Are there any other questions about having a mental health practice with seniors? There are so many assisted living facilities that are around. All you've got to do is go in and talk to the executive director or the wellness director and let them know that, hey, I am a licensed clinician. I'm a licensed clinician. I really want to make my services available for the people here. Are you open to that? And if they say yes, great. Many ALFs will not let you go door to door and say, hey, this is who I am, or let you hand out flyers. That's going to be a no-go. But what you can do is you can create rack cards that are set by the sign in and sign out book. That's a great place for them. You can, some of the ALFs will let you create the little things, I don't know what you call them, that you set on the dinner tables, like you have at restaurants that advertise the current specials. And you can put information about your services. One of the things I found most helpful on the rack cards is on one side have a checklist of symptoms that may indicate that your services might be beneficial. And then on the other side, have information about you a little bit and contact info. That can be a super helpful way to get referrals. If they know that you're going to be coming out, then they may also suggest to their resident that they reach out to you. Now, some ALFs are fine if the nursing director, for example, or the wellness director says, I have these 5 people I'd like you to check in on. It doesn't mean that they are necessarily appropriate for services or want services, but you can drop in, you can say hi, you can do a quick screening, and if they're appropriate and wanting services, then you can set up a time to get them, do a full assessment on them. That is the easiest way to start making inroads. I know a few therapists who have created relationships with executive directors, and they go in and they do some sort of fun therapeutic recreation type activity once a week. It's non-billable, but it's just let's do seated Tai Chi, or let's do some art activities. You can't really call them art therapy unless you're a certified art therapist. But they go in and they help people develop some basic skills for wellness, regulation of their nervous system, etc. And it's a lot of fun. You've got to make it fun, though. They're not going to come sit and listen to a lecture. So that's another way to get people to know you and be willing to reach out to you. The other benefit you have as an independent clinician is basically they can hold you accountable. A lot of these agencies that are pushing their way into ALFs make a lot of promises about, we're going to put a therapist here, we're going to have somebody here 5 days a week, blah, 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 and nobody ever shows up. And then the executive director gets frustrated because they're like, I've got 8 people that really need and want to see a therapist, and I got nobody showing up. When's the therapist going to be here? If you are an independent practitioner, then you are solely responsible for making sure you show up. And that's a huge selling point, as opposed to, a lot of times you think, well, the agencies have a better selling points because they're agencies. No, not really. Not really. My experience in Tennessee has been most facilities would much rather deal with a single person who says, I'm going to do this. And then, if they don't do it, fine. You can cancel the agreement or whatever. You don't, since most ALFs, it's basically like an apartment complex for seniors. It's not a forced residential setting. And this is the ALF side, not the memory care side. But for the non-memory care side, the rules are really a lot different. You're billing insurance as if you were seeing somebody in their home. And individual residents are able to come and go as they want to, which changes the regulations a lot, because you're not marketing to a confined population. Well, I'm glad you were able to make it back and heard most of it, Crystal. Oh, Roller Girl. Okay, I got it. I'm putting it all together now. Great to see you back, Roller Girl. It's been a minute, so I'm glad to see you. If there are no other questions about opening a practice with older adults, then hello. Then I am probably going to sign off for today, but I hope everybody, if you are a therapist or you know a therapist who's like, I'd really love to actually have some human contact again, that's me. I really, really despise telehealth. And so it can be a great outlet, even if they only want to see residents 1 or 2 days a week. That's usually plenty. They can pick up 1 or 2 facilities in their local area and probably have more potential clients than they need. So it can be a good source of supplemental income if they don't want to work full time. If they want to do it full time, there are plenty of ALFs. You may just have to contract with, 3 or 4, because a lot of them are smaller. They have a 50-person bed cap, and some of those people are over on the dementia wing. Oh, let me mention that. If a person has dementia and cannot reasonably be expected to benefit from psychotherapy, you can't bill Medicaid or Medicare either. So if there's somebody over on the dementia side and they're lonely and they just want to talk, well, that's wonderful. And if you can find it in your heart to do that, that will pay you, in my mind, that'll pay you in karma, but you can't bill Medicare for it. So just kind of bear that in mind when you're dealing with Medicare. I always think ahead in terms of trigger a clawback, because I really hate giving back money. We used to occasionally have them when I worked in community behavioral health when we'd have an audit, and I was like, but I don't want to give it back. We had to give it back. All righty. Lily, you want to come say hi to the people? Come here. Oh, I don't think they want your bone. Come here. Lily, come up here. No, I'm not playing tug. Lily's not much on getting up on your lap. Boo Boo will get up on your lap. You just got to be careful of that wild tongue of his. Alrighty, everybody, have a fabulous rest of your weekend, and I will see you on Monday. Okay, let me down.